Hello everyone, I'm Berk. It has been on the agenda a lot lately, and I will talk about the silicone sleeves referred to as penis enlargement. Of course, when we talk about penis enlargement, I always mention that there is a lot of confusion about the concept among people. I mentioned that both lengthening and thickening are different things, and I had made a video about that as well. We know that silicone sleeves have an effect on thickening, especially in total sexual activity. So what exactly is this penis sleeve? This is a silicone sleeve. It's a special kind of silicone. Look, they come in different lengths and they can be cut to fit the individual. They have different thicknesses and are placed just under the skin, right here, on the upper part of the penis where it becomes erect. And in this way, the lower part is open. Because that part needs to be open, like this. Otherwise the urinary tract is underneath. It can also be compressed. That's why it has a semicircular shape. Of course, it shouldn't be confused with other things. You know, when you search for silicone sleeves for the penis online, you'll find these plastic covers that are meant for fantasy or sexual purposes, which cover the entire penis. You know, a lot of them, you can use the high quality ones, but most of them products have very high allergic properties. You need to be careful when buying these. That's not what we're talking about. This is a sleeve, or that is put on the penis for fantasy purposes, like a condom. It's true that it thickens the penis, but the penis is already inside. This, on the other hand, is a medical device that is placed with a very different surgery. So what's the purpose? The first purpose is to increase the hanging length of the penis. The second purpose, which is actually the main purpose, is to increase the thickness of the penis, both when it's flaccid and when it's erect. So actually this procedure is essentially a thickening procedure because it doesn't change the length of the penis during an erection or sexual activity. Since it is in a normal position, penis cannot go back because it is not erect, so its position is more. It allows the penis to stay longer and more visible. In terms of sexual function, it actually corresponds to thickening. Now, who is it not recommended for? This is very important. If there have been any previous procedures in that area, like fat injections, hyaluronic acid, or dermal grafts, it's not recommended to have silicone sleeves placed there because there is already a foreign material in that area, and when something is added on top of that, complications can occur. Also, it's essential for individuals to be circumcised. This isn't very important to us. Most people are already circumcised, but it's quite significant in Europe and America. Before this procedure, before doing it, 3 weeks ago, the person needs to be circumcised at least 3 to 4 weeks prior. There aren't many studies available right now, so there are different brands of silicone sleeves for the penis. There are different names, but they all go by the name of silicone sleeve in the end. I read these studies while preparing this video. I had read it before. There are 2 important studies among these. One of them is actually the first study that was done on this. One of them is the most recent one, a multi-center study published in 2024, where one of the people applying this in 2024, a multi-center study published, meaning one of the people applying this was done by a person applying this silicone sleeve. In the other one, results from different centers were evaluated. I will provide the results for both. In the single center study, there are 400 patients. So the same person treated 400 patients. Look, this is very important, so remember this. I will remind you shortly. I'll explain why it's important. In the multi-center study, there are also 299 300 patients. The sagging thickness has increased from 8.5 centimeters. It has increased to cm, so approximately here, or we're talking about this thickness. The sagging length has increased from cm, cm. Here, it has increased by km. There is no data regarding erection length, but there are photos. So when we look at the erection length before and after, there is only increase in thickness. They didn't give the ejection thickness either, but that's normal anyway. As the sagging thickness increases, we expect the erection thickness to increase as well, and that's exactly what happened. So in conclusion, for example, if your erection is 13 centimeters, your erection length will also remain 13 centimeters. There won't be any change in this. So is this a harmless thing? So should we do this for hair restoration? What are the complications? Now, in a single center study, that let's say side effects or complications are fewer. Studies from 4 centers show more. This is actually normal because there's a learning curve to this job. There's a huge difference between doing a surgery for the first time and doing it 400 times. Of course, these 4 different centers have treated 300 patients. So, while 4 or maybe 5 different surgeons have treated 300 patients, a single surgeon or 2 surgeons have treated 400 patients. Therefore, complications, the things being done, and side effects are gradually decreasing. Of 400 patients, 12 had reactions removed. Here, 21 patients had theirs removed. There have been issues and they were removed. Here, 21 patients had theirs removed. 7% is quite high. Here, percent of patients had to undergo surgery again. So 4 patients, here. 17 patients had to undergo surgery. So here, the erosion we talk about, maybe it's a reaction from the body against the silicone sheath, issues like blood flow disturbances in that area, etc. It's generally the most common problem, but whatever happens, you can say this. If you decide to go ahead with this, if a Hycon sheath is placed, there's a 3, 4, 5% risk of needing to be removed again. So there's a risk of a second surgery and a risk of removal. We can say this. Before or after these surgeries, no one has experienced loss of sensation, loss of firmness, or anything like that. So technically this is not expected because it's with skin. You're placing it between the penis. As for firmness, there won't be any increase or decrease in the amount of firmness, just like the length hasn't changed. Also, there is no loss of sensation. Now this method, what did we say our goal is with this method? The direct equivalent in sexual drinks is thickening. I place a lot of importance on this because if you're going to take action regarding penis enlargement, we need to get its equivalent in sexual drinks. So when a person is urinating, or there's not much point in making the penis look a bit bigger. The goal is to use it. Ask your partner if they prefer it longer or thicker. Ultimately, this is an organ that needs to be used, and if you think the other person will get more pleasure from it, which is especially important for couples. So if you are going to have something done, ask your partner whether it is longer or thicker, because it's a procedure that requires mutual agreement. Patients ask me if I perform this procedure. We are not doing this right now. I don't do it. Am I considering doing it? No, I'm not. Why? Because the ultimate goal in sexual relations will be thickening. So, what were the other methods of thickening? Yes, non-surgical penis enlargement does provide a visible increase, about 1 centimeter in thickness, but it's not very satisfying. There's nothing comparable to it. However, I don't use fat injections anymore. You know that I only use hyaluronic acid. When I compare it to hyaluronic acid injections, then there are many advantages to using hyaluronic acid. It's not even a surgery. When I compare it to hyaluronic acid injections, there are many advantages to using hyaluronic acid. It's not even a surgery. It takes about half an hour to 40 minutes to complete. It can be done repeatedly. It can provide lasting results between 2 to 5 years. Therefore, the risks of complications are very high, low. If you consider all of this and also think that the cost is lower, I mean, rather than undergoing such a surgery just for thickening and taking on some risks, then it is much better to just do the blooding in food acid. It seems reasonable. This is but my opinion. Other doctor friends or colleagues may not agree with this. This is also something that depends a bit on the patient's wishes. Whatever the patient wants, we should try to fulfill all their procedures and desires without causing any harm if possible. Another situation is, of course, in terms of permanence. If you ask which one is more permanent, then of course, when you place the silicone, if there are no issues, it becomes a permanent situation. You know, this is a situation that lasts for a lifetime. Of course, we don't know what will happen in 10 years. And also, one of the ones who does the most for me is that, so, okay, after 1 year, 2 years, 3 years, 5 years, 10 years, 15 years, because those who want this thickening procedure are always young. I mean, they are not like our prosthesis patients. Penial prosthesis patients are mostly in their 60s and 70s or after 50. But those who want this procedure, those who want thickening, are sexually active and young patients. Let's say someone is 25 years old now. If you say 70, we don't know where that will lead in 45 years. More about that, the data is not available. So the acid lasts about 5 years. It already disappears in a year. There are no issues. Innovation. From that perspective, who can prefer it just for thickening right now? This is especially for those whose penis somewhat retracted inward, meaning it's not bad in terms of firmness, but it constantly stays pulled inward in people who are uncomfortable with this. This method can be preferred, but when they thicken it with hyaluronic acid and fat, it becomes a bit more pronounced. That also provides satisfaction. I saw that from my own condition. Can it be preferred in that case as well? Of course, this is also related to the doctor-patient compatibility. You need to talk to the person who will do this job and make a decision with them. But the clear point that needs to be known is this. The equivalent in sexual intercourse is the thickening of penile implants. You definitely need to research and look into the alternatives. Thank you.